हेलो वेलकम फ्रेंड्स, वेलकम टू फार्मा वेदा ज्ञान। तो आज हम डिस्कस करेंगे फार्मेसी के बहुत इंपॉर्टेंट क्वेश्चंस जो कि फार्मास्यूटिक्स फर्स्ट पार्ट के रहेंगे। तो सारे क्वेश्चंस इंपॉर्टेंट रहने वाले हैं जो कि सभी वैकेंसियों में जो है आते हैं फार्मासिस्ट की।
Question Bank of Pharmaceutics I. Multiple choice questions. 1. The Sanhita includes reference to drugs of animals, plants and mineral origin used until the 1st century AD. A. Ebers B. Charka C. Hippocrates D. Shushruta 2. Who is the father of medicine? A. Ebers B. Hippocrates C. Egyptian D. Pontus 3. Use of formulations made up of numerous plants referred as A. Galenicals B. Parenteral C. Plant vehicles D. Generics 4. The first pharmacy shop was opened in A. London B. Baghdad C. Bangalore D. Damascus 5. The first edition of IP was published in A. 1965 B. 1975 C. 1955 D. 1985 6. The second edition of IP was published in A. 1955 B. 1966 C. 1985 D. 1997. The third edition of IP was published in A. 1985 B. 1990 C. 1960 D. 1975 8. The fourth edition of IP was published in A. 1985 B. 1990 C. 1960 D. 1996 9. The fifth edition of IP was published in A. 1996 B. 2000 C. 2007 D. 2010 10. The sixth edition of IP was published in A. 2005 B. 2008 C. 2010 D. 2012 11. The seventh edition of IP was published in A. 2014 B. 2015 C. 2013 D. 2012. The chairman of the first edition of IP was A. Dr. B. N. Ghosh B. Dr. B. Mukherjee C. Dr. Nithyanand D. Mr. Prasnatota 13. The Pharmacy Act came in force in A. 1947 B. 1948 C. 1949 D. 1950 14. Pharmacy Council of India was established in A. 1947 B. 1948 C. 1949 D. 1950. 15. What is USP? A. The United States Pharmacology B. The United States Pharmacy C. The United States Pharmacopoeia D. The United States Pharmaceuticals 16. The first U.S. Pharmacopoeia was published in A. 1820 B. 1822 C. 1823 D. 1821 17. The first national formulary was published in A. 1860 B. 1885 C. Published in A. 1820 B. 1822 C. 1823 D. 1821 17. The first national formulary was published in A. 1860 B. 1885 C. 1888 D. 1890 18. Supplement to the first edition of IP was published in A. 1960 B. 1975 C. 1965 D. 1968. 2. 19. Supplement of the second edition was added in A. 1960 B. 1975 C. 1965 D. 1968 20. Drugs converted to suitable form are known as A. Excipient B. Source of drug C. Dosage form D. API 21. Full form of MDI. A. metered dose inhaler B, metered dose inhalation C, metered drug ingestion D, metered drug infusion 22. Every dosage form is a combination of drug and different kind of non-drug components called A. Additives B, non-additives C, new chemical entity D, all of these 23. Simple syrup is a saturated solution of A. Sucrose B, fructose C, dextrose D, none of these 24. In purified water, the concentration of sugar according to IP is A. 67% WWB, 66.7% WWC, 77% WWD, 65% WW25. The spatulation process is well suited for mixing of which of the following powder? A. Hygroscopic B, volatile C, eutectic D, effervescent 26.
Which of the following is a eutectic substance? A. Menthol B, thymol C, camphor D, all of these 27. A convenient method for mixing redox substance is A. Spatulation B, tumbling C, sieving D, trituration 28. Capsules in which powders are enclosed are made up of A. Gelatin B, rice flour C, fructose D, dextrose 29. Douches are meant for application in A. Buccal cavity B, rectal cavity C, vaginal cavity D, nasal cavity 30. In females, the drug should be given very carefully in which stage? A. Menstruation B, lactation C, pregnancy D, all of these 31. When two or more drugs are used in combination to increase the pharmacological action, the phenomenon is known as A. Synergism B, tolerance C, potentiation C, idiosyncrasy 32. When the action of the drug is opposed by the other drug, the phenomenon is known as A. Antagonism B, analgesic C, addition D, antioxidant 33. Is the state of psychic and physical drug dependence A. Habituation B, addiction C, anxiety D, tolerance 34. Acute tolerance is also known as A. Addiction B, idiosyncrasy C, tachyphylaxis D, habituation 35. A genetically determined abnormal or unusual response to a drug is A. Idiosyncrasy B, tolerance C, genetic polymorphism D, salicylism 36. Powders used for external use are A. Dusting powder B, bulk powder C, divided powder D, effervescent powders 37. Bulk powders are A. Potent B, non-potent C, both are NBD, none 38. Insufflations are introduced into which of these body cavities? A. Nose B, throat C, ears D, all of these 39. Powders are more stable than 3. A. Syrup B, tablet C, capsule D, elixirs 40. A suitable is added to maintain the powders until the mass becomes coherent but not too damp. A. Coloring agent B, flavoring agent C, sweetening agent D, granulating agent 41. What will increase the bulk of product? A. Processing aid B, diluent C, granulating agent D, organoleptic additive 42. According to IP 2007, oral powders are A. Finely divided B, bulk powders C, effervescent powders D, douche powders 43. Which powder must be sterilized before their use? A. Medicated dusting powders B, non-medicated powders C, natural dusting powder D, surgical dusting powders 44. The monophasic liquid dosage form is solutions. A. True B, coarse C, fine D, micro 45. The component present in solution in small quantity is known as A. Solvent B, solution C, solute D, liquid 46. The component present in solution in large quantity is known as A. Solvent B, solution C, solute D, liquid 47. Solutions are dosage form A. Monophasic B, biphasic C, triphasic D, solid 48. Throat paints are liquid preparations. A. Viscous B, non-viscous C, solid D, gas 49. Nasal drops should have pH A. 5 to 6 B, 6 to 7 C, 7 to 8 D, 8, 9, 5 O. Nasal drops are A. Isotonic B, hypertonic C, hypertonic D, none 51. Enemas are also called as A. Elixir B, suspension C, emulsion D, Clistrec 52. The syrup is a nearly saturated solution of A. Sucrose B. Sorbitol C. Glycerine D. PEG 53. The syrup is, in nature, A. Aqueous B. Non-aqueous C. Gas D. Solid 54. Which of the following is not monophasic liquid dosage form? A. Solution B. Gargle C. Suspension D. Enemas 55. Elixirs are A. Hydroalcoholic liquid B. Aqueous C. Viscous D. Semi-solids 56. Is not a type of syrup. A. Simple syrup B. Medicated syrup C. Flavored syrup D. Mixed syrup 57. Liniments must not be applied on the skin. A. Swelled B. Broken C. Painful D. Normal 58. Enemas are administered A. Rectally B. Orally C. Parenteral D. Externally 59. Drops are used in otic cavity. A. IB. Ear C. Nasal D. None of these 60. Is used as a throat paint vehicle. 4. A. Glycerine B. Water C. Syrup D. Solution 61. In artificial syrup, which ingredients is used? A. Glucose B. Sucrose C. Fructose D. Saccharin 62. Which of the following excipient act as preservative? A. Sorbitan monolactate B. Tyloxopol C. Benzathenium chloride D. Thiomersal 63. Buffering agent is also called as A. Sweetening agent B. Thickening agent C. pH modifiers D. Wetting agent 64. Saccharin is an example of A. Natural sweetening agent B. Flavoring agent C. Artificial sweetening agent D. Humectant 65. Suspending agent imparts A. Solubility B. Viscosity C. Absorption D. Wetting 66. Disodium EDTA is an example of A. Sweetening agent B. Flavoring agent C. Chelating agent D. Preservative 67. Which of the following is natural colorant? A. Amaranth B. Erythrosine C. Carotenoids D. Eosin 68. Cochineal is A. Agent A. Flavoring agent B. Sweetening agent C. Coloring agent D. Thickening agent 69. Which of the following is anti-foaming agent A. Methyl cellulose B. Aspartame C. Sucrose D. Simethicone 70. Which of the following is not a vehicle? A. Glycerol B. Water C. Butylated hydroxyl toluene D. Rose water 71. BCS stands for A. Biopharmaceutical Classification System B. Biological Classification System B. Binominal Classification System D. Basic Classification System 72. Cetramide and macrogols are an example of A. Sweetening agent B. Coloring agent. Emulsifying agent D. None of these 73. Need for mouthwash is the result of a condition called A. Yawning B. Halitosis C. Indigestion D. A. Sore throat 74. Are oily or aqueous solutions that are administered rectally. A. Suspension B. Otic solution C. Nasal drops D. Enemas 75. Diffusible drugs are formulated without the use of A. Buffers B. Wetting agent C. Suspending agent D. BNC 76. CPT consists of A. 20% acacia, 20% tragacanth, 15% starch, 45% sucrose B. 20% acacia, 15% tragacanth, 30% starch, 35% sucrose C. 20% acacia, 25% tragacanth, 30% starch, 40% sucrose D. 20% acacia, 15% tragacanth, 20% starch, 45% sucrose 77. Which of the following enzyme is present in acacia? A. Peroxidase B. Ligase C. Alpha amylase D. Glutamate 78. The prescription is an order written by a registered medical practitioner to A. Patient B. Pharmacist C. Compounder D. Nurse 79. In which language the abbreviations in the prescription writing is very common, especially in dosage instruction? 5. A. Latin B. Greek C. French D. French 80. The prescription must be received and checked by the A. Physician B. Patient C. Nurse D. Pharmacist 81. The superscription is represented by a symbol A. RXB, DCC, Doc D, PH 82. In the day of mythology, the symbol RX was considered as a prayer to A. Jupiter B. Jesus C. Neptune D. Dhanvantari 83. The abbreviation of Latin word RX is A. Your take B. To make C. to sold D, to use 84. The part of the prescription called inscription contains a name and quantity of ingredients B, name, age C, signature, address D, registration number and patient information 85. The last item written in the inscription is A, vehicle, diluent B, active ingredient C, medicament D, quantity 86. The part of prescription called subscription contains a direction to the pharmacist B, direction to the patient C, direction to the patient's relatives D, all of these. 87. The action-based error is also called as A, slits B, lapse C, exhaustion D, application 88. The memory-based errors are also known as A, slits B, lapse C, knowledge D, reports.